We are all going to be on our deathbed someday. Every single one of us. Hopefully it's in a very long time when we're 90, 100, 140 years old, whenever. And we're going to have an opportunity to reflect back over the previous 140 years of our life and think, what did we do with those 140 years? I can't stand the idea of not living my 10x life so that when I go to God at the pearly white gates, I can say, I did my best with what you gave me to help make the world a better place. Welcome to episode 6 of the Dr. Chris Stepien Show, where my mission is to help people who are suffering and the doctors, therapists, and healers who are committed to doing something about it. I don't know if you're anything like me, but I need to feel like the things that I'm doing to help other people are things that I really believe in. People always say they hate sales. And the reason why they hate sales is because they think that they're going to have to be selling something that they don't believe in themselves. Well, when I was in chiropractic school, I realized that adjustments weren't really helping me. And I was really struggling to figure out if I was going to continue to become a chiropractor or a doctor who help people in pain. Today, what I want to talk to you about is what I feel is the ultimate vehicle for a manual therapist's dream life. If it weren't for this specific vehicle, I wouldn't be a chronic pain doctor now. I wouldn't be helping people in chronic pain. I wouldn't be helping other doctors help other people in chronic pain as well. And it really means a lot to me. When I realized that chiropractic adjustments weren't helping me in chiropractic school, I got lucky. About halfway through school, I caught a lunchtime lecture by the one lecturer that Dr. William Brady from Integrative Diagnosis gave at New York Chiropractic School in Seneca Falls, New York. And he asked a question. And he said, how many of you are being taught in chiropractic school that you can help everyone with every specific problem they have with chiropractic adjustments? And we all raised our hand because that's what we're being taught in chiropractic school. And Dr. Brady said, well, I don't believe that, but I do believe that you can help some people better than anybody else is helping them. And he was talking about people in pain. And I've taken that further even to being helping people in chronic pain, a worse problem. The very cool thing about becoming world-class at fixing the most common cause of chronic pain in 30 to 60 year olds that 9 of 10 of our patients I never heard of at Barefoot Rehab, adhesion, is that it solves a few problems. And I think of this in a Venn diagram. One is it gets amazing patient outcomes without surgery or medications for people who have had pain over 6 months and seen at least 3 doctors or therapists without relief. 2, it allows you to market in what I call as a blue ocean. You may have heard of a red ocean when it comes to marketing, which means there are lots of sharks in the water. So the sharks are eating all of the people up. There are 3,000 chiropractors in New Jersey. There are 8,000 massage therapists. There are 9,000 physical therapists. That's a lot of therapists helping all these people in pain. That's a red ocean. A blue ocean means there's a lot of demand and very little supply for a very specific problem. Chronic pain is something that's very hard to fix. Most chiropractors, PTs, massage therapists, medical doctors, and even surgeons aren't necessarily marketing towards, I want to help you, the person in chronic pain. So it's a blue ocean strategy. So we have the amazing patient outcomes for people in chronic pain. We have the blue ocean strategy when it comes to marketing. Down here in the Venn diagram, you can make really good money. So you can make as much money as a surgeon as a manual therapist, which is kind of crazy. So in my best month as a single doctor, we grossed over $60,000. And so if you do math, if that's 50% margins, that's a $30,000 month net for me. That equates to about a $360,000 per year salary, which is really awesome. And the cool part about this is that if you can fix the people in the blue ocean in chronic pain when nobody else is fixing them, and you can get them amazing results, they are happy to pay your rates, whatever they are. And currently in our rates at Barefoot Rehab, they're $3,600 up front for 16 treatment visits at 15-minute visits. So the whole idea with this vehicle, you've heard of like investment vehicles. There's real estate, there's stocks, there's investing in businesses. So when it comes to manual therapy or being a doctor, you can do chiropractic adjustments, you can do rehab, you can do acupuncture, you can do some other neurological technique. The Adhesion Release Methods vehicle works really well for people who want the amazing outcomes, who want to help people in chronic pain, and who want to make really good money. If you're still listening to this, my intention right now is to poke the bear. What I've realized is that people who have it good, doctors who have it good, they make over $100,000, or they're adjusting patients and the patients are really happy to get popped and cracked, but their pain always comes back and they don't really say anything, but they keep coming in and you keep making money and you have a good lifestyle and you're happy. They don't really care about what I'm talking about now. Everything is too good. Good is the enemy of great. People who are comfortable are going to and continue being comfortable. I'm not talking to those individuals right now. I'm talking to the other individuals who aren't happy with good, or maybe it's bad. Maybe you're not making good money. Maybe you're not getting good patient outcomes. Something is not right. I know for me, we are all going to be on our deathbed someday. Every single one of us. Hopefully it's in a very long time when we're 90, 100, 140 years old, whenever. And we're going to have an opportunity to reflect back over the previous 140 years of our life and think, what did we do with those 140 years? I can't stand the idea of not living my 10x life so that when I go to God at the pearly white gates, I can say, I did my best with what you gave me to help make the world a better place. I can't stand it. I can't stand good. I want to shake everything that's comfortable. I want to make it uncomfortable and painful so that I make the most out of what I have. If you're anything like me, learning how to become world class at treating adhesions is extremely worthwhile. This week, we had a patient fly from Michigan to New Jersey for a pudendal nerve entrapment. He had some groin pain and penis numbness for the past 7 years. We treated his pudendal nerve, one treatment at his butt cheek at the sacrospinous ligament and in his pelvic bowl. And then James, our clinical assistant, spoke with him yesterday, 3 days after we saw him, and said that the numbness and tingling already get better. He's really happy with his progress. We have a patient, Dawn, who had spinal fusion a few years ago. She's been driving up from Maryland for the past 3 to 4 months. She's about 80% better. The other day on Friday, she was crying on the table because something happened to her son. He was shot in a road rage incident and she was crying, and we just slowed down. We talked with her, but she's 80% better with her pain. I guess I'm sharing some of her backstory because the types of people that you're able to heal and fix and also hear and help is extremely rewarding when you're able to connect with them and just be there for them in a way that you're not able to be there for them if you're not getting them relief. Because if you're not getting them relief and they keep coming to you and they're driving up 4 hours, 3 hours from Maryland, they're not going to keep coming up to see you. Or I have another gentleman from New York City who's coming out to New Jersey. He was supposed to get a hip replacement. He's about 50 years old. After the first treatment, he smiled and he said, "You passed the double secret probation." I think that's a quote from Animal House or something. He's a really silly guy. The best part about being an adhesion release methods practitioner is you get to perform miracles every single day. We have about an 85% success rate on the patients that we accept into Barefoot Rehab, and we're qualifying every single one of those patients. They had to have pain over 6 months and seen at least 3 other doctors or therapists without relief. Generally, they're between 30 to 60 years old. Once they get over 60 years old, they're 70, they're 80, they're 90, the prognosis goes down. That doesn't mean that I haven't helped people who are 85 years old before, but our sweet spot is between 30 to 60 years old. They're old enough to have lived years where they have adhesion in their body from overuse or trauma, and they're young enough that they don't have severe joint degeneration in their body. The more severe joint degeneration they have in their body, the less possible permanent relief they're going to get. If they were 40 years old, and they would get 100% relief. If they wait till they're 50 years old, they're going to get 80% relief. If they're 60, they're going to get 65. If they're 80, they're going to get 40% relief. So as they get older and that joint degeneration gets worse, fixing their adhesion is not going to get them as much relief. That's why we focus on 30 to 60 year olds. At this point in time, I'm recording this in November 2023. We started Adhesion Release Methods in January 2023 because we saw that no one was teaching doctors and therapists how to become world class at fixing adhesion. Yes, active release technique talks about adhesion, but they're generally just teaching doctors and therapists protocols where you stick your finger in a muscle in any random spot and then you stretch the muscle. That's not good enough to fix people in chronic pain. So that's why we evolved it and are taking it further. We have about 20 doctors or therapists inside the system. I really try to qualify the doctors and therapists and make sure that they're ready to develop themselves and work really hard, because people in chronic pain need doctors and therapists who aren't just dipping their toe, but who are really committed to fixing those patients. I want to tell you a little bit about Dr. Jen, one of the chiropractors who I actually went to school with, and she practices in Buffalo at Thrive Chiropractic in Buffalo, and she's definitely one of my best students so far. Within about 6 months of starting Adhesion Release Methods in January, she increased her revenue $5,000 per month, which is awesome. She's also getting better patient outcomes. She texted me this morning a picture by a little girl, and the little girl drew a picture thanking Dr. Jen for fixing her mom. mom. And last time I spoke to Dr. Jen when she was here at a hands-on workshop in New Jersey, she was saying and getting emotional about how she's finally fixing people in a really significant way. These are people who have had pain for a long period of time, have seen other chiropractors, physical therapists, massage therapists, and basically have nowhere else to go for their chronic pains, and they think they have to live the rest of their life with their pain, and they're scared that their pain's going to get worse. It's extremely rewarding for Dr. Jen, the other doctors in Adhesion Release Methods, and myself to be hearing these success stories. It makes me feel good about myself. It makes me feel really proud of the work I'm doing. It allows me to go to sleep at night knowing that I did the best I could for every single patient. A lot of the Adhesion Release Methods providers who are currently with us, they hate the feeling of going to bed at night knowing that they're not fixing a patient. They despise it. It makes them sick to their stomach. They want to help people. They have a strong empathy muscle for those people who are suffering. My hope for you today is that you are inspired, if you're a chiropractor, physical therapist, massage therapist, acupuncturist, osteopath, to do more with what you have as a doctor, your license, your ability to help people and fix people. There is a chronic pain pandemic, and people are suffering enormously. 50 million people last I looked in the United States, and by being chronic, they're not getting their pain fixed, which becomes an enormous opportunity for doctors and therapists who want to work hard, becoming world-class at diagnosing and fixing this little problem called adhesion. I hope you're inspired to not let good become the enemy of great, to make good really uncomfortable so that you make great, make the best of your life by becoming a badass doctor or therapist who can fix chronic pain, who has a heart of gold, who listens and hears all these people who are struggling, who goes above and beyond to make their life better by potentially saving them from the pain that's going to haunt them from the rest of their life. We have a 5-day find, feel, and fix the worst spot that causes chronic sciatica challenge on adhesionreleasemethods.com. I broke down in steps over about 50 minutes over 5 days how exactly you feel the sciatic nerve in the butt cheek, how you see if the sciatic nerve is stuck or it's healthy, how you set up tension on it getting ready to do a treatment pass, and how you do a treatment pass so that you can start to fix the worst spot that causes chronic sciatica in all these people worldwide that have nowhere else to go. This challenge is free. I hope you will take it. I hope you will practice each day. I hope you will study with it. I hope you will do it on 10 to 20 patients over the next 1 to 2 weeks and get better at feeling and get yourself better every single day over the next 3 months, 6 months, year, 5 years. If you do only that protocol, you could probably make a very successful practice in treating chronic sciatica for the rest of your life. And then if you're interested to take that further, please reach out to me at drchris@barefootrehab.com, and we can talk to see if you're a good fit to become an Adhesion Release Methods provider, because we're doing something about this chronic pain pandemic. People are suffering, and without us, they will continue to suffer. And I'm looking for the doctors, therapists, and healers who are committed to doing something about it. Have a good day. I love you.